Heights. I am a parent resource coordinator at the Munroe-Meyer Institute, and I'm just going to go ahead and kind of give our brief introduction here. Oops. So again, thanks again for coming tonight. I know the world is a little bit crazy right now, and so I appreciate you all taking the time to come and learn some information about the Nebraska Medicaid system and the other economic assistance programs. We felt that this was a topic that could be really timely and beneficial for a lot of families right now who may be experiencing different types of economical loss, or just knowing what services are available in the state of Nebraska. Again, our focus primarily has been to navigate the disability services, but really this can actually affect a lot of different people. And we wanted to make sure that families knew about things that they maybe, if they have experienced some sort of wage loss or job loss recently, or in general, some of the things that they may be eligible for that potentially they might not have been previously. So just a few things. If you could please submit all questions via the Zoom chat. If you're not familiar, there is a feature, and it's either at the very top or the bottom of your screen, and it will say chat. And you can just go ahead and type in a question, and then myself or Jennifer will get that to the presenters when they've got a moment to speak. We're going to go ahead and keep everyone on mute. We are recording this, again, hopefully with the idea that we would like to then be able to put that and make that available for people at a later date. We're just kind of working out the kinks as far as like what's the best venue to do that. And at the end, I do have an online survey. It's really brief, just a couple of questions, but there's also an opportunity if you would like more information, or for myself or Jennifer to contact you with more information. We can then do that if you provide your email address. Oh, sorry. We do have a few upcoming sessions as well, and we've just gotten these kind of confirmed. In a couple of weeks, we're going to have Tony Green from the Developmental Disability Services on the 28th. Social Security Disability will be a presentation by Josette Bright and Shauna Dahlgren. May 12th, Guardianships and Alternative, which is Marla Lemke-Fisher. And May 26th, Educational Supports, and that will be Teresa Hayes from the Department of Education and Sandy Peterson from PTI Nebraska. So tonight I'd like to introduce, we have two wonderful presenters that are going to be providing the information for us tonight. Wendy Walgrave is the Eligibility and Operations Administrator for the Nebraska Department of Health and Human Services, and Darla Berger is a Community Support Specialist with the Nebraska Department of Health and Human Services. This is actually the link to the survey. So I will have it here and also have it, I'll bring that up again at the end so that way we can get your feedback. This is really helpful for us to know if we're really hitting the mark as far as things and topics and presentations that are helpful to you, and if there's things that we can do to improve those. So we really do appreciate your feedback for all of these sessions that we are holding. So if you wouldn't mind taking just a few seconds to fill that out completely anonymous, just so we can get some feedback as to how we're doing. And with that, I will get this switched over for Wendy and Darla. Okay, can everybody see that okay?
It should be. It's nice and big.
There's no screen.
Yep. So welcome everyone. Thanks for being here tonight. Like Rhonda said, I'm Wendy Walgrave. I'm with the Department of Health and Human Services, and with me tonight is Darla Berger, who has also been with the Department of Health and Human Services. Between the two of us, I think we've got more than 50 years on the books. So we've been around for a while, and I've had lots of different experiences. So we are looking forward to just kind of giving you an overview, and then really opening it up for some questions that you may have, or some, we'll give you the opportunity to direct the conversation a little bit and really target what you want to know tonight. So I'm going to let Darla start tonight, and then I'll jump in where needed.
So I'm Darla Berger, and I'm a community sports specialist with Department of Health and Human Services. And what that means in an abbreviated version is that we're kind of a liaison between our system, between DHHS and the agencies and the clients that we're both serving. So we're kind of a conduit. We should always have a pulse on what's going on in the communities and have resources available. So I always tell people, use this system, use DHHS system as designed, but when that's not working or somebody doesn't fit into that system, then reach out to your community sports specialist. And there are 4 of us across the state, and I cover everything from Douglas County around to York. We have another community sports specialist in Douglas County, and then we have a community sports specialist that covers everything north of Douglas County and around towards Valentine, and then another one in the western part of the state. So I will share that map, and so that you have the contacts for all those community sports specialists, and you can reach out if you ever have any issues. The first screen, the first couple screens are actually some messages from our governor. And so the first one kind of talks about the vision and priorities and what we value in DHHS. And I'll let you guys just look at that for a minute. The second screen is in a tiny font, and so it's a little bit harder to read. And it talks about our accomplishments. And so obviously the things that we've worked hard to achieve in the last few years. And then the next screen, again in small font, is where we're headed in our priorities. And one of the priorities we have coming up, obviously, is the expanded Medicaid program. And when Wendy talks about Medicaid, or when we get done, if you have any questions specific to that, I'm sure that we can address those as well. So those are kind of the message from the governor. I'm going to talk in general terms at first, and then I'll get more program specific as I move along. So
Darla, can I interrupt you for just one?
Sure, absolutely.
Oh, I'm so sorry. I just wanted to make sure everyone, I know the slides, I have not been able to send those out ahead of time because we did not have the registration, but if you do include that on the survey, I can send these out after the presentation. So if you don't get those right now, get all the information and read through all the small print, you'll have an opportunity later.
Yeah, it's pretty small font. I apologize for that. And then the next slide is a little bit easier to read, and it talks about our division. So we are behavioral health, children and family services, which is my division, developmental disabilities, which you'll hear from Tony in a couple weeks, Medicaid and long-term care, which is Wendy's division, and then public health. And so we say to people, we literally take you from birth to death, because we handle everything from your birth certificate to your death certificate and everything in between. So the quality of your water, the licensing of your healthcare providers and your hair salons, and everything else. So those are our 5 divisions. We used to have Veterans Affairs, and then that switched over to VA, or to a different division a few years ago. But about 50% of our money comes in from the federal government, and about 45% is state funds, and the other 5% is just cash funds. And about 80% of our dollars are spent back for services to families. So that's kind of how our fiscal part of that runs. I'm going to go ahead and talk about the economic assistance programs first, and talk about Access Nebraska a little bit, and then Wendy will talk about Medicaid. So there's about 24 programs that provide support for those that have low income. And I'm going to look at these in general terms first, and then we'll talk about these more specifically. So the programs for low-income families are everything from the SNAP program and or food stamps, as some people still like to refer to it, but technically it's the term is SNAP. And then the ADC program, the age of blind and disabled, there's a grant and a medical part of that. The energy assistance program, supportive services, and then child care subsidy. And then on the next slide, it talks about emergency assistance, which I'll talk about in a minute, and then the Medicaid and waiver programs, which Wendy will talk about. So we cover, like I said, a lot of different programs. On our website on Access Nebraska, when we get to that slide, I'll show it to you. There is a point where it talks about the different programs. So if like next week you're like, I don't remember what Darla said or what Wendy said, I'll point that out to you on that slide. You can actually go into Access Nebraska and see those programs a little more specifically as well. And I'm going to talk a little bit in general on these. So we, again, offer dozens of programs for low-income families. One of the things that's important right now is maybe families have been denied in the past, maybe for income or another reason, but now with the economic changes due to COVID-19, they may qualify because their income may have gone down or even ended. So families that have said, well, I applied before and I was denied, if they had a change in their situation, they should be reaching out to us and see if they qualify now. And there's some waivers that we are, some have gone in place already, and some of them we're still working on, that will also make some exceptions to due to the COVID-19. So just stay in touch with us if you think a family might qualify. I'm going to go ahead and talk about the program guidelines. Vary from program to program. Obviously, we have several dozen programs, and so these can be slightly different. But one of the things we always look at is citizenship or qualified alien status. So qualified alien status is somebody who entered the country as like a refugee. There's about 16 different ones on that, and that varies a little bit on some of the programs. But we look at citizenship and qualified alien status. We look at Nebraska residency, their identification. They'll need to give us their social security numbers, and then we look at income and resources depending upon the program. That does vary from program to program. I'm going to look program specific now. So the SNAP program stands for Supplemental Nutritional Assistance Program, and that's actually used to buy food items. It's a USDA operated program. It's one of the only ones that we facilitate that is out of USDA. So some of the guidelines are slightly different because it's a different division, a different federal division. And for the SNAP program, their benefits are placed on an EBT card, an electronic benefit card. It looks like a debit card. And they get their food stamp benefits or their SNAP benefits on that each month on their allotted day. Any amount that they don't use that month carries over into the next month. So they don't have to exhaust those. They can, store those up if they have a light food month or trying to save up for a bigger event, bigger food grocery shopping. When we look at SNAP eligibility, we look at who's in the household, who's purchasing and preparing meals together. There is a work requirement for people who don't have dependent children in the home or aren't exempted for medical or a variety of other reasons. We look at student status for those who are of higher education, and then there's a felony status. And on the next slides, you will see I'll talk about drug felon, but for SNAP, with the last farm bill, there was a change to the felony status, and it has now added people convicted of felony for murder, sexual predation, trafficking. So some more populations were added to that. So you'll see here, I talk about felon status, but when I get into some of the other programs, it'll be specific to drug felon status. And so that is a little bit of a difference and fairly new because it was passed late this fall with the Farm Bill. The next program is the ADC or TANF. People kind of interchange that name. And that provides financial assistance to needy dependent children and the parent or relatives with whom they're living. And I want to emphasize something in there. I know you guys have some guardianship, and I saw somebody came on and they work with kinship cases. So a lot of people think that it has to be their own children. In Nebraska, we have about 12,000 relatives who are raising their children. And we know that probably only about 1% of those are getting ADC payments for those children. So if you're working with those kind of families, please remind them that they could possibly qualify for an ADC grant to help offset the financial costs of raising the children. So an ADC case can be 1 or 2 parent households, or like I said, it could be a relative or a kin who's raising that child. In that guidelines, they have to cooperate with Employment First, which is a work program. We'll look at the cause for unemployment. We look at that relative relationship. They must cooperate with child support enforcement unless they have good cause not to cooperate. And then you'll see I mentioned drug felon status here. And with the drug felon status, it's 3 charges of possession without treatment or conviction for sale or distribution. And that would disqualify that parent for the ADC program. Aid to the Age of Blind and Disabled is a program that supports those who are age 65 or older, or if they're under 65, it's somebody who's been determined blind or disabled by Social Security Administration. And in that program, we look at who's in the household. We look at what income they have and what income they need. And if there's a gap in with the grant program, then they can provide a check that helps submit that meet that grant gap. So for instance, if you have somebody who's getting SSI and they're in an alternate living facility, that facility is going to cost more than the SSI income would be. In those cases, there's times in that we give them an AABD grant, and then that helps meet that gap of living expense and allows them to be in that living arrangement. And then also in that program is a state disability program, and that's for people who have been working and then have maybe a short-term disability. They won't qualify for Social Security Administration programs because they'll be disabled less than 12 months, but they need some help, medical or financial, in between. And we look at the state disability program for them. And then we have the Energy Assistance Program, which ends, I guess, at midnight today for right now for the heating assistance. So there's 2 components to that, and basically we look at economically vulnerable. So with the heating program runs through the months that are coldest, October through March, and that's based upon household size and then what their utility type is, and then if they're in a house or an apartment. And in that case, if they're found eligible, then that allotment is sent to usually the heating source to help offset those heating costs. It can also sometimes help with furnace replacement or repairs if they own their home as well. And then starting June 1, we'll start the cooling assistance, and that is June, July, and August. And that population served is a little more restricted. It's for people age 70 or older, or households with children age 6 or under on ADC, or the key one is they have a health condition, a disability, or medical condition that requires cooling. So like COPD or asthma or high blood pressure, diabetes, in those cases, then we get medical proof and we can look at cooling assistance for them. So, and again, that is the program that provides the fans in the summer months and also can look at repairs or replacing air conditioners if need be.
Darla?
Yes.
We had a question again, if you could take a minute and explain the felon status again.
For SNAP or for ADC or for both?
Well, it wasn't specific. How about both?
Okay, all right. So for SNAP, it is a little bit different because that passed under the Farm Bill. So the recent change to that was anybody with the drug felon status or somebody who's been convicted of murder, sexual trafficking, or predation. And so, and a couple other populations on that. And in that case, if you have, let's say you have a parent and 2 children, then they, the parent would not qualify, but the children could still qualify for SNAP if they meet the other eligibility factors, or for ADC. And SNAP is the same way, other than the felony is different. For SNAP, it is, it's a drug felon status. And so in that case, if they've been convicted felony for a sale or distribution, they're permanently disqualified. Or if they've had 3 or more convictions for possession and didn't do treatment, then they can be convicted. And if they did treatment and they still have 3 for possession, they're permanently disqualified. And the same thing, it's the parent who's disqualified, not the children. Did that answer the question?
I think so. And with the ADC grant, all of these programs that Darla is going through at the moment are economic assistance programs. And so when we get to the Access Nebraska website, which Darla will get to in a minute in this presentation, it would be applying for economic assistance programs. And then you would be able to choose, do you want to apply for SNAP benefits or energy assistance benefits or ADC benefits. So it's that, all the economic assistance programs are on one application. And then Medicaid does have separate applications for their benefits right now. So, all right.
This next program is one of my favorite programs, and I think it's probably one of our most underutilized programs. And the key thing you want to remember about that is in the bold on the bottom of the page, it said services are intended to help somebody be as self-sufficient as possible. So this is our supportive services for elderly, blind, and disabled. And it's where we come into the home and we can provide them chore services, which are light housekeeping, like things like laundry, grocery shopping, meal prep, light housekeeping, respite care you see is on there, both adult and day services are on there, and then home delivered and congregate meals. And of course, right now, we don't, the congregate meals are shut down because of COVID-19, but that would normally be a service provided. So social services for aged and disabled is a really nice program for people who have somebody who's elderly, blind, or disabled and try to stay in their home and try to stay safe and self-sufficient. And in that case, like I said, we can bring a lot of services into the home for a lot less money than long-term care would be. When it gets too medically involved, then it switches to the Medicaid side, and then Wendy can address that question. But this is a great service for families who are struggling to try to keep that elderly person that they love or somebody with a disability in their home and keep them safe and make sure that their needs are being met. The next program is Child Care Subsidy. And this is, again, assists low-income families in paying for child care. This could be 1 or 2 parent households. It is income-based. And so we look at, they have to have a need for service. So if there's 2 parents in the household, they have to both either be working, going to school, looking for work, going through training. We look at the definition of a family. And then again, based upon their income, there could be a sliding fee where they have to pay a portion of that cost. If their income is low enough, they could obtain that child care at no cost. So that is, again, a sliding fee basis. And it does require cooperation with child support enforcement unless they're exempted for some reason for good cause, which is like cases of abuse or domestic violence. Emergency assistance comes under the ADC program. It actually comes out of those funds. So it does require that there be a dependent children in the home. And this is provided once during a 12-month period. We have a little exception for that during COVID-19, but otherwise it's usually provided once during a 12-month period. And in this case, what we look at is maybe there's been a crisis in the family. Most of the time they're doing okay, but they had the flu go through the family, so mom missed 2 weeks of work, and now she's not able to pay her rent or mortgage, or sure, she needs help with utilities. Or let's say they had a move, there was, something comes up unexpectedly, a car repair, something like that. So what we look at is what can we do, what services can we bring in financially to help that family stabilize and return. And we look at sustainability on that. So if they weren't able to pay rent last month and they won't be able to pay it again next month, then again, they probably will have an issue of sustainability. And again, keep in mind, this is outside COVID-19. But right now we've got a couple exceptions on this because of COVID-19. So this is a good program, again, for families who just kind of hit that crisis and need a little bit of additional financial support to get them back on track. And it does require ADC, dependent children in the home. Any questions on the economic assistance programs that I didn't answer? I know somebody's watching chat for me.
So we did have a question about transportation.
Okay.
And so transportation, I'd kind of thrown that answer in the chat there. It really depends on the reason for the transportation. We can do some limited transportation within the social services for aged and disabled, that block grant program, that supportive services program. And then transportation is also covered under Medicaid if there's a need for non-emergency medical transportation to get folks to and from doctor's visits or therapy appointments, or you know, dialysis, or there's a number of reasons that we can do that. So transportation is covered there as well. So yep, I will do that. So Medicaid. So Medicaid right now, we have the ability, there are, Medicaid sounds like it's one program, but really Medicaid is kind of the umbrella that encompasses a bunch of different programs as well. And really how we kind of divide our programs currently is how we use families' income to budget them. So we have what we call MAGI programs and what we call non-MAGI programs, which for you don't mean a whole lot, but I'm going to help you out a little bit on that. MAGI programs is a federal program that came in under the Affordable Care Act. And what that does is allows us to look at a household's adjusted gross income instead of going down to the exact penny that they bring home in their paychecks and looking at their resources and everything else. So the MAGI budget methodology looks at the household's income and compares it to the federal poverty levels. And those poverty levels really kind of change based on the age of the individual in the household. So there are much higher income limits for pregnant women or for children that don't have health insurance in any other way, shape, or form. And then the income limits decrease a little bit for kids that are school-aged up until they turn age 19. At the age of 19, individuals are considered adults in the state of Nebraska. So Medicaid for children's coverage will end when the child turns 19, okay? When we look at somebody who has a disability or is aged, those are non-MAGI programs, meaning we do need to look at all of their income coming into the household, both earned income and unearned income. So any money they have coming in from a job, any money coming in from Social Security or from SSI, from unemployment, from child support, all of that income is counted in a non-MAGI budget. And non-MAGI budgets are pretty much at this point for, like I said, the elderly and aged and disabled. Currently, with Nebraska Medicaid, we have a gap. So parents and caretakers with dependent children in the household and those dependent children can qualify under MAGI programs. And then we have the aged and disabled that are age 65 and older or have a disability as determined by Social Security. Where Medicaid expansion comes in is that gap between the ages of 19 and 64. That program is slated to go live in October of this year. We will start accepting applications in August of this year, but eligibility will not begin until October of this year. So with that new category coming into Medicaid eligibility, that will also be budgeted as a MAGI program, meaning that we don't need to look at money in bank accounts or trust funds or any of that stuff. But if somebody has a disability determination and will continue to be budgeted on that non-MAGI side, that requirement is still there. Okay, that was a lot in a very short period of time. So Nebraska Medicaid categories here for birth through age 18 or 65 and older is currently the age groups. We will, starting in October, cover that group from 19 to 64. Disability currently will be determined by the Social Security Administration. Darla mentioned the state disability program. That was for individuals that have kind of that short-term disability of it's severe, but less than 12 months in duration. Currently, that would go through our state disability program. When this new Medicaid category comes online in October, that would also be a category that we could look at with the expanded Medicaid populations. We also have a program right now for former foster care that will allow for those individuals that are in the foster care system at the age of 18 and age out to have some expanded coverage as well until they turn 26. So there are some specific online or guidelines for that specific population. So
I'm going to look a little bit at Access Nebraska. So if you are applying, and this will talk about how you can apply, kind of what that application process is. And so Access Nebraska is actually our service delivery in Nebraska. And we've been doing this for over 10 years now. And basically the structure of Access Nebraska is a couple of things. We have customer service centers. And so there are currently 4 of those. We're getting ready to add another one, but there's currently 4 of those, 2 for Medicaid and 2 for economic assistance. And those are located in Nebraska, Lexington, Scottsbluff, Fremont, and Lincoln. And those are staffed by DHHS employees. We also still have staff in the local offices. And so you can go into any of the local offices and see a worker or get services as well. And then across the state, we have over 600 community partners. And those community partners, and I'll show you on our website where those are listed. And they're agencies. Some of you may be community partners or work with an agency that's a community partner. So those community partners are places like the food bank and community action, where they actually help people access our benefits and help kind of work with us to make sure people are getting the services that they need. So that's kind of the structure of Access Nebraska. The goal of Access Nebraska was for increased accessibility. So we didn't really take away anything. We still have our local offices. We still have paper applications for people who prefer that. What Access Nebraska did was brought in web-based services. It brought in phone applications. We have kiosks in the local offices, and then where people come and use the computer if they want to, or our phones or our copiers or scanners. And then, like I said, we have those community partners. So with Access Nebraska, we really didn't take away any service. We just increased accessibility and ways that people could apply. I talked a little bit about those customer service centers. Again, they are available and staffed by DHHS staff. So you can call in and you can do an application. You can have questions answered. You can report a change. You can ask for definition or change a question on your case. You can complete phone applications. We were just talking before the call started, of course, with COVID-19 and a lot of people who have unfortunately lost employment. Our applications are literally like tripled and through the roof. I think last week they were taking 300 calls per hour. So a lot of more volume right now. But in a typical month, we get about almost 5,000 for economic assistance, almost 5,000 phone applications a month. So the workers are taking a lot of calls by phone, and again, still paper applications and then web-based applications. And the customer service center is there to help support that. You see the hours are posted for you. And again, they can provide information, answer questions, do your interview, you can report changes, and you could actually do a phone application if you wish as well. And right now, again, we're trying to encourage people to use the phone versus coming into the local offices for obvious safety reasons right now for all of us. A little bit about our local offices. Again, we have staff across the state in local offices, and I'll show you on the website in a few slides where you can see that listed at. And you can come in and do face-to-face appointments if needed. We have a kiosk where you can use the printer, you can use the copier. You can use our phones. You can use our computer to apply for benefits. You can drop off verification. So those local officers are available across the state to help support people in their application process. Again, the goal of Access Nebraska was increased efficiencies. We are paperless, so everything that is sent in to us is scanned in. In an average month, we scan over 600,000 pages of documents. So if Medicaid receives that document, economic assistance can see it as well. It goes right into the person's master case. So that's really beneficial because anybody looking at their case then will see all information that we have, any documentation we have received on that case. So that was part of the goal of Access Nebraska, was increased efficiency and being paperless, so everything is tied directly to that case. Once an application is submitted, whether it's submitted by paper or by phone or emailed in, the department will contact you. If you've given us permission, we will text you or email that person and get in touch with them. If we can't reach you that way, we'll try by phone or then send a letter for an appointment. If an interview is required, we'll set up that interview time. And any verifications that are needed, then we'll be you'll be informed of what those documentations are needed. And then we process from that. Anytime we need anything else, again, we'll try to reach out in those messages the fastest we can with text message, email, or phone call. Okay. We also have a voice response unit, which is available 24/7. And through that unit, you can call in to find out if your case is active or what the status of your case is. It also has some provider information on that for child care providers and other providers. And then finally, the last, I want to look a little bit at the Access Nebraska website. So the website, again, is where you would start that application process. A couple of things about this: if you're going to be using the system a lot, applying and need to check on benefits, we encourage you to set up My Account. In My Account, if you set that up, you'll have access to your current benefits, any correspondence we've sent us. You can see what your status is. If you need verification for, say, free or to reduced meals, you can print that verification there. But that's a nice tool to manage your own case for people who are going to be using that or be savvy to use that. Wendy talked about, we have a separate application for economic assistance, which are the programs I talked about. There's the developmental disability application. And then to the far right on that bottom part is the Medicaid application. On the lower part of that screen, you'll see, do I qualify? This is a great tool for somebody who says, you know, I don't know, last time I was denied or my income has gone up, I'm not sure if I qualify. They can go into that screen, fill out some basic information, and then they'll get a results back saying it is worth your time to qualify for this program, or it'll tell you, you know, yeah, this time you don't look like you would qualify, or it can recommend other programs too that you might qualify for. And then it would take you right into the application process if you choose to move forward. One of my favorite features here is submit documents. I always discourage people from faxing us documents. You just heard the volume of papers we have come in each month. In this submit documents, if something has been saved as a PDF file or a JPEG file, you can actually submit that document. And so like agencies can do that, or teachers can do that for their students if they need to. And you'll get a verification that the document was received, and then you'll get an email verification when that's been scanned into the case. So you'll know those documents have been received and put into the master case. So that's a good way to submit required documents. And then finally, also on here is report changes, which is a really good tool. If you don't want to go online and wait on the phone, you can come in here and you can report change of address or new household member, a change in job, a change in daycare, any of those. I want to point out across the top of the screen here a couple of things. There's the DHHS programs under the upper right-hand corner under useful links. So I told her, if you forget what I said or what Wendy said and you're not sure about our programs, you can go to GHHS programs and it will give you a description of the various programs. So then if you're not sure if it's an economic assistance Medicaid program, you can kind of look at that. We have a list of community services. There's printable forms. So if somebody tells you I need an employment verification form, you could go and print that, and then that again would save you having to reach out to us on that. Those 600 community partners that I talked about are listed there, and that sorts by county or city. So if you are trying to help somebody, maybe they're in Gothenburg and you're not sure who's in that area, you could sort by county or city and see what agencies are in that area. And then there's just some other tutorials of ReliaCard information and ways to contact us. So these are the things that are available on Access Nebraska that kind of help people through that process as well.
So we did have some conversation in the chat box about, are the local office open right now with the COVID-19 situation going on? And the answer is yes. We still have people in all of our local offices right now. However, we are strongly encouraging people to use our online services. We don't want people out and about in the community unless they absolutely have to be. So using the online documents here to submit documents, report changes, fill out applications is really the best way to go. You can also call our customer service centers and complete an application online or on the phone with them as well. However, quite truthfully, going through the Access Nebraska website is much quicker than even getting it through it on the phone right now. We are experiencing some high volume with a lot of people experiencing some really challenging situations with employment right now. So really the quickest way is to go online and access things online. So kind of one of the other things, we've had lots of chat also about, you know, disabled children over the age of 19, and really right now with the current Medicaid regulations, you need that disability determination by Social Security. It doesn't necessarily need to be an SSI payment. That child may be eligible for Social Security payments, maybe on a parent's claim. That will still give us that disability determination that we're able to use with that. There are a couple situations where we can look beyond the Social Security determination. For example, I know we have children whose parents' income disqualifies them from SSI because of the parental income. Some of our waiver programs allow us to waive counting that parental income, and that requires the use of our state review team process. And there are some very specific criteria about being able to directly refer to that state review team for a review, or if we need to wait for Social Security to make a determination. So we really take a look at those situations really on a case-by-case basis to help with that. So the waiver programs, there's an adult waiver program. So it's Aged and Disabled Waiver Services that provides support in the home. And really with our waiver services, both the children's waiver and the adult waiver, what we're really looking at is, does that individual require nursing facility level of care? And would it be better to support that child or that adult in their current living situation with additional supports in the home versus paying for nursing facility level of care? And that's really kind of that defining line. With our waiver programs, we never want to say that, you know, somebody has to be a specific way or another in order to get support, but it really is looking at that level of care required. And those two specific waivers really focus on that nursing facility level of care. Developmental disabilities uses a different level of care determination. And we'll let Tony speak to that next time when you get the opportunity to talk to him. But the developmental disabilities waiver is a little different. We also have the ability to look at which waiver is the best fit for an individual. And if somebody maybe they had a significant level of care change where previously they were nursing facility level of care, and now maybe they've seen some drastic improvements in their condition, but they would still be appropriate for another waiver, we can look at doing those waiver to waiver transitions and really helping support families through that transition and maintaining that level of service so there aren't any gaps. We had a question, what's the turnaround time from application to hearing if officially qualified for any program and benefits begin? So right now, honestly, I will tell you, it really depends. On the Medicaid side of things, we truly try to have everything determined within 30 to 45 days. A lot of times we are much quicker than that. However, depending on individual financial situations, if we have to review, established trusts or annuities or anything, it can take us a little longer than that. On the economic assistance side, our goal is truthfully to have those benefits determined within 30 days. And again, our goal is always to be much quicker than that. I believe our current response time currently is about 12 days on programs. So it really kind of depends on the influx of stuff we have coming in and our ability to respond to that timely. So.
Okay, I think there's a couple questions on chat for you, Wendy. I'll kind of finish out here. The next slide talks about my account. And anytime anybody is applying for public assistance benefits or Medicaid using Access Nebraska, you have to sign in through your account. And a lot of times people get confused here and they think, so like if I'm helping, someone else apply, and it's going to ask me, I put in my user ID and my password, and I can create a new account. It'll ask you a couple of security questions. But I use this all the time when I'm helping people who aren't going to use the system a lot, or maybe don't have access to a computer. So even if you're an agency, you can set up an account and then help other people apply for public assistance by setting up the account. The only difference is if you set up an account as a new user, it'll ask you for a PIN number, and you can't get a PIN number usually unless you're on public assistance. So you can just say no to that and move forward. But this is a good way. If you're helping a lot of families apply for public assistance, just set up an account, and it's a lot easier than going through the 3 security questions and stuff every time. So, and then the next slide just asks us if there's any questions. I think most of you are putting those in. We'll give you a couple minutes to get caught up on those. And then my contact information is there. And then I will also share through the email for those of you who do this survey, I'll share you the contact information for the 4 community support specialists that serve Nebraska. But if you can't reach them, reach out to me. I'm always happy to get you referred on.
Okay, so I do see a couple extra questions in chat. Can you explain to me how an adoption subsidy affects a disabled child to qualify for additional services like the waiver program? That's a tricky one. Really, we look at those truly case by case. The Aged and Disabled Waiver Program is designed to be the program of last resort. And so we really look at what is able to be provided through the adoption subsidy first, and then how can we fill the gaps with the Aged and Disabled Waiver Program. So I wish it were really that clean cut. A lot of times, we've got some courts and judges that want to know more specifics on what we can and can't provide than we can really give until we know what that adoption subsidy is going to cover. So we do a lot of kind of negotiating back and forth on what that looks like and how we can get folks the support that they need. It's really not a cut and dried situation. So really reach out if you have questions on that. We can take a look at things case by case, but it's really hard to give a more specific answer here. SRT disability determination. I got a question on how often it needs to be done and also to describe the process. So SRT is our state review team, and the state review team basically looks at the same criteria that Social Security looks at for determining disability. They use the same guidelines, same criteria to make that disability determination. So we have a team that encompasses some nurses and physicians on that team that do the medical review on that. Generally, it's done for a period of anywhere from 12 months to 36 months, depending on the diagnosis that's been given. Basically, we are asked to submit the same level of documentation to the state review team that you would be asked to submit to Social Security. To determine, again, we're looking kind of at that, the severity and duration of that disability determination based on Social Security criteria. So generally, like I said, for the kids we have involved in the waiver, generally we review those about every 3 years. But sometimes it can be less than that if it's a condition that could see a significant change in the next 12 months. So you may see a shorter duration on that SRT review if that happens. And so basically, like I said, we're gathering medical documentation. We're going to ask for current medical records that include therapy notes, the primary care physician, any specialty physicians that are involved, and to get the most accurate picture of the person's health situation, and do they meet that level of disability that Social Security requires. So waiver to waiver transition. Basically, in order to do the waiver to waiver transition, you need to actually lose eligibility under one waiver before we're looking at transitioning to another waiver. So if you have somebody that would qualify under the children's waiver, and then no longer meets that nursing facility level of care, we could potentially look at transitioning to the DD waiver. But you'd need to lose eligibility under one waiver before we could look at transitioning to another waiver. CHIP is another Medicaid program that falls under that Medicaid umbrella. So it's the Children's Health Insurance Program. And basically the requirement, we're going to look at all Medicaid programs available to that individual or to that family up front. So we're going to start with our income guidelines for our age specific. So we're going to look at the pregnant women's program first, and then we're going to look at the children's programs or the school age programs for those individuals based on their age category. If the individual does not meet those income guidelines based on the age category that they qualify for, then we're going to look to see if the individual has other primary health coverage. If the individual doesn't have any other primary health coverage, then we're going to look at eligibility under the CHIP program. So one of the primary requirements under the CHIP program is that the children cannot have any other credible health insurance. So if there is credible health insurance available, then CHIP is not an option. All right. Sorry, I'm trying to catch up on the chat here on some of those. So if your kids no longer qualify for Medicaid, are they automatically looked at for eligibility for CHIP? The answer is yes. If an agency sets up an account within Access Nebraska, is there a specific sign-in that all employees need to use within the organization? Darla?
They would just set up an account, and then you'll fill out the application for the person you're assisting, but your name won't be on that application unless you list that as like you know, a contact person or something. So you'll just fill out the application for the person that you're assisting with their information on it, not using your information, unless you're a relative or responsible for that person in some way.
So, and if a family was denied Medicaid and the children are not on CHIP, it's either because the income exceeds the levels required for CHIP or there's credible health insurance that exists within that family. All right. There's a specific question about Medicaid and DD waiver and qualifying for unemployment. Truthfully, I'm not going to speak to that one right now because a lot of the rules are changing really quickly with the COVID-19 response, and I can't guarantee one way or another. We have several waivers in right now, requests in to expand our guidelines surrounding the COVID-19 situation right now. And things are changing too quickly, and quite truthfully, I don't know the answer to that. Historically, unemployment does count in that Medicaid budget. However, based on current situations, I don't know if that'll be accurate or not. And we do have a request in for a couple of different waivers that would impact that answer. So I can't guarantee that answer. All right. TEFRA is another term that's in here. That is not a term that I'm familiar with in the Medicaid world. I've heard that term used more on the DD side of things. And I can't really speak to that because it's not a term that we use in our world.
Yeah, ask Tony in 2 weeks.
Any other questions out there? Oh, I just saw the question about the plan series that had been the companion self-determination piece. Yes, we are planning to go ahead and have that series later on, but since that one is so heavily interactive, it just couldn't be done currently at this point in time. But we do have, that is one of our goals, is to bring that back when we're all able to get together.
So Sarah, you did have a follow-up question on the waivers. We are hoping within the next couple of weeks we'll get some guidance from the Center on Medicaid Services federally. All of our waiver requests have to go through them for approval, and I know that we do have some pending. So we're just waiting a response back from them at this point. So I'm hoping very soon, but I don't have a date right now. I don't know if that Appendix K amendment has been posted anywhere for Medicaid or not. I can follow up on that. And if that is available, then I will get that information over to Rhonda to share. So, and there's another question. If health insurance is offered through employment, then the children would not be eligible for CHIP. If the children are covered under other insurance, the children would not be eligible for CHIP.
So I think that's a great clarification, Wendy, because I actually do get that question quite a bit. You know, families wondering if it's something that's offered by their employer, but maybe still is something that they really just can't afford, if that would still be a possibility for them.
Yes. So CHIP, that happens all the time, honestly, where family coverage is just so out of households' budgets that they cannot afford that family coverage. We understand that. So it's just, the CHIP program is intended to cover individuals that have no credible health insurance. So if the children are covered under any other insurance, then they're not eligible for CHIP. But otherwise, if it's not affordable, then the children are still eligible. There are specific circumstances where maybe it would be more beneficial to have the children eligible under their parents' insurance that's offered through an employer. We do have a program that's the Health Insurance Premium Payment Program that will look at that as well to determine if it's more cost effective, basically, for us to pay that health insurance premium versus offering full Medicaid coverage. So that health insurance premium payment program is also available, and that's probably a program that you're going to be hearing more about with the expansion of the Medicaid population this fall.
And for that application process, though, even though there are multiple different programs, they would just need to apply in the one place through Access Nebraska. Is that correct?
There are two different, it really depends. If the family could end up needing to use two applications. One for the economic assistance programs, that would be the SNAP and the ADC and the supportive services and the energy assistance. Medicaid is a separate application. So they would need to fill out two applications if they're wanting SNAP benefits and Medicaid benefits. Those are two separate applications that are handled by two different groups of people.
Okay, I guess I should have clarified. I meant the different insurance or health coverage. Yes. That's all through one kind of portal, and then the economic assistance is another. Okay, thank you. If there aren't any other questions, looks like we do have a couple more that just popped up here.
So if an adult student with a verified disability, SSI verified disability is covered by a parent's insurance plan, can they be covered by Medicaid? The answer to that is maybe. With that, so yes, they'd have the disability determination, but then we'd have to go down the road. If they are currently receiving an SSI payment, they would be eligible for Medicaid. If they are not receiving an SSI payment because of other sources of income coming into the household, then we have to look at the adult student's total income and resources available to that person to determine the Medicaid eligibility. So, and yes, Medicaid can be a secondary coverage. So, and Amanda, to answer your question, I guess, do you want it to be the end of the Medicaid portion of the webinar? So if there are additional questions, we can certainly take any additional questions.
Okay, I am going to go ahead and put up our the survey. So if you all wouldn't mind taking that.
Rhonda, is there a way for you to cut and paste that into the chat?
I don't know. Let me see if I can do that. I will give that a try. Oops. I'm not sure I can on my computer. Jennifer, would you mind seeing if you can either?
It doesn't look like I can highlight it in order to.
Okay. Maybe.
Yeah, I said, say try it from there.
It looks like Amanda got it.
Well, thank you, Amanda. I appreciate your assistance here. We're kind of winging it, but I will be prepared next time. So again, that kind of covers what we were planning to go over this evening. I really appreciate all of you kind of taking some time with us this evening as we are going through this really kind of unprecedented and crazy time. Hopefully this information was helpful to you. Again, on the flyers that went out and all of the announcements, my email address and phone number are on there as well. So if you have additional questions, but if you wouldn't mind taking the survey and, like I said, including your email address on that, I think it's the last question, then we can go ahead and get that information out to you so that you have all of the contact information and the slides from tonight. So thanks again, everyone, for joining us.